G'day folks, Dr. Liam Cartwright here. Now look, I'm gonna cut straight to the chase because I know you blokes don't have time for waffle. After more than 30 years working as a men's health physician here in Brisbane, I've had thousands of conversations about prostate health, and I reckon it's time we had a proper yarn about something that affects every single man watching this video. Here's the question I get asked all the time in my clinic. Does regular ejaculation, whether through sex or masturbation, actually help your prostate? The short answer is yes. And I'm going to explain exactly why, give you the research to back it up, and tell you what you need to know to keep your prostate in good nick as you get older. So let's get into it. Your prostate is a small gland, about the size of a walnut, sitting right below your bladder. Now, most blokes don't give it a second thought until something goes wrong, and fair enough, it's not exactly dinner table conversation. But here's the thing, this little gland is absolutely crucial to your quality of life, especially once you hit 50 and beyond. The prostate produces a significant portion of the fluid that makes up your semen. It's got muscles that help propel that fluid during ejaculation. And because of where it sits, wrapped around your urethra, any problems with your prostate can affect everything from how you pee to your sexual function to your overall sense of well-being. Now, I've been practicing medicine since the late 80s, and I can tell you that attitudes towards talking about this stuff have changed dramatically. Back then, blokes would rather chew glass than discuss their prostate or their sex life. These days, thankfully, more men are getting clued up about their health, and that's bloody brilliant. Let me explain what actually happens inside your body when you ejaculate. When you reach orgasm, whether through intercourse or masturbation, your pelvic floor muscles contract in a coordinated rhythm. These contractions essentially pump fluid through your prostate and out through your urethra. Think of it like flushing the pipes, if you'll excuse the plumbing analogy. This process does a few important things. First, it clears out old prostatic fluid that's been sitting in the gland. Second, it stimulates blood flow to the area. And third, it gives those pelvic muscles a bit of a workout, which helps maintain their tone and function. Now here's where it gets interesting from a medical standpoint. When a man goes for extended periods without ejaculating, that prostatic fluid can accumulate. The prostate keeps producing secretions, but if they're not being cleared out regularly, you can end up with what we call prostatic congestion, or congestive prostatitis. I see this fairly regularly in my practice, actually. A bloke will come in complaining of a dull ache in his pelvis, maybe some discomfort when he sits down, pressure in the area between his scrotum and his rectum, or a vague heaviness in his lower abdomen. Sometimes there's discomfort during or after urination. And when we do the workup, rule out infection and other causes, we often find it's simply congestion. The good news is this isn't a serious condition in itself. It's uncomfortable, sure, and it can cause a fair bit of anxiety, but it's not dangerous. And the treatment is pretty straightforward. Regular ejaculation, whether through sexual activity with a partner or through masturbation. That clears out the accumulated fluid and usually resolves the symptoms within a week or two. I had a patient a few years back, a retired truckie from out west, lovely bloke in his early 60s. He'd been widowed for about 18 months and had basically stopped any sexual activity altogether. Came to see me convinced he had prostate cancer because of the persistent discomfort he was experiencing. After ruling out the nasties, we had a frank conversation about what was likely going on. He was a bit embarrassed at first, but once he understood the physiology, he took it on board. Came back a month later feeling right as rain. Now let's talk about something that's been the subject of some pretty significant research over the past couple of decades. The relationship between ejaculation frequency and prostate cancer risk. There was a major study published in the journal European Urology back in 2016. Researchers at Harvard followed nearly 32,000 men over an 18-year period. What they found was that men who ejaculated 21 times or more per month had about a 20% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. 20% is not nothing, folks. That's a meaningful reduction in risk. Now, I want to be clear about something because I don't want anyone walking away with the wrong idea. This doesn't mean that masturbation prevents prostate cancer. Correlation isn't causation, and there could be other factors at play. Men who ejaculate more frequently might have higher testosterone levels, might be healthier overall, might have other lifestyle factors that contribute to lower cancer risk. But the research is certainly suggestive that regular ejaculation plays some kind of protective role. The thinking is that frequent ejaculation helps flush out potentially carcinogenic substances that might otherwise accumulate in the prostatic fluid. It's similar to the idea that regular bowel movements help reduce colon cancer risk by moving potential carcinogens through the gut more quickly. Another factor that's been studied is the effect of ejaculation on hormone levels, particularly DHT, or dihydrotestosterone. DHT is a potent form of testosterone that plays a role in prostate growth. It's actually DHT that's responsible for benign prostatic hyperplasia, or BPH, that enlargement of the prostate that affects most men as they age. During ejaculation, there's a temporary reduction in DHT levels. This gives the prostate a bit of a break from the constant hormonal stimulation it otherwise receives. Over time, this regular cycling might help keep prostate growth in check. Speaking of BPH, this is something I need to address because it affects the majority of men over 50. By the time you're in your 60s, there's about a 60% chance you'll have some degree of prostate enlargement. By your 80s, it's closer to 90%. BPH itself isn't dangerous. It's not cancer, but it can cause some bloody, annoying symptoms. You might find yourself getting up multiple times a night to pee. You might have trouble starting your stream, or it might be weaker than it used to be. You might feel like your bladder isn't emptying completely. These symptoms can really impact your quality of life and your sleep, and poor sleep affects everything else. While regular ejaculation isn't going to reverse BPH once it's established, maintaining good prostatic health throughout your life might help slow its progression. And keeping those pelvic floor muscles strong through regular use certainly helps with urinary control. Let me take a moment to talk about chronic prostatitis, which is different from the congestive prostatitis I mentioned earlier. Chronic prostatitis is inflammation of the prostate that persists over time. Sometimes it's caused by a bacterial infection, but more often it's what we call chronic pelvic pain syndrome, where there's inflammation and discomfort without any identifiable infectious cause. This condition can be really frustrating for patients and doctors alike because it's difficult to treat and tends to come and go. Symptoms include pelvic pain, painful urination, pain during or after ejaculation, and sometimes flu-like symptoms. What we do know is that oxidative stress and the accumulation of metabolic waste products can contribute to chronic inflammation in the prostate. As we age, our bodies become less efficient at clearing these waste products, which is why chronic prostatitis tends to be more common in older men. Regular ejaculation appears to help by promoting circulation in the pelvic region and assisting with the clearance of these inflammatory substances. It's not a cure, but it's part of a comprehensive approach to managing the condition. Now, I want to address something that comes up a lot when I talk to patients about this topic, and that's the psychological and emotional aspects. Look, we're not robots. Our sexual health and our mental health are deeply interconnected. Men who maintain an active sex life, whether with a partner or through masturbation, tend to report better overall well-being. They feel more confident, more vital, more connected to their bodies. And that matters, especially as we get older and face all sorts of challenges to our sense of self and our identity. I've seen blokes who've basically given up on their sexual lives after a certain age, whether because of health issues, loss of a partner, erectile difficulties, or just the belief that it's somehow not appropriate for older men. And without exception, these men tend to struggle more with depression, anxiety, and a general sense of disconnection from life. Staying sexually active, in whatever form that takes for you, is about more than just prostate health. It's about maintaining your vitality, your connection to your body, and your sense of yourself as a complete human being. Right, let's talk about what you should actually be doing to look after your prostate. This is the practical stuff. First, regular ejaculation. Based on the research, somewhere around 21 times per month, or about 5 times per week, seems to be associated with the best outcomes. But look, don't stress about hitting an exact number. The point is regular activity rather than long periods of abstinence. Even 2 to 3 times per week is likely beneficial. Second, and this is crucial, get your regular checkups. If you're over 50, or over 45 if you have a family history of prostate cancer, you should be having a conversation with your GP about PSA testing. The PSA test isn't perfect. It can give false positives and false negatives, but it's still a valuable screening tool, especially when tracked over time. Don't be one of those blokes who avoids the doctor because you're afraid of what they might find. Early detection of prostate cancer makes an enormous difference to outcomes. Prostate cancer caught early is highly treatable. Left until it's advanced, the picture is much more complicated. Third, pay attention to your diet. There's good evidence that certain foods support prostate health. Tomatoes are particularly beneficial because they contain lycopene, a powerful antioxidant that seems to have a protective effect on prostate tissue. Interestingly, lycopene is better absorbed when tomatoes are cooked, so pasta sauce, tomato soup, even tomato paste on your sanga is doing you good. Other foods that appear to be beneficial include fatty fish like salmon and mackerel, which are high in omega-3 fatty acids. These have anti-inflammatory properties that benefit the prostate. Green tea contains catechins that have been shown to inhibit the growth of prostate cancer cells in laboratory studies. And cruciferous vegetables, your broccoli, cauliflower, Brussels sprouts, contain compounds that support healthy hormone metabolism. On the flip side, there's some evidence that high consumption of red meat and dairy products might be associated with increased prostate cancer risk. I'm not saying you need to become a vegetarian, but moderation is probably wise. Fourth, exercise regularly. Physical activity improves blood flow throughout your body, including to your prostate. It helps maintain healthy hormone levels and supports your immune system. Even moderate exercise, like a 30-minute walk most days, makes a difference. Specific exercises for your pelvic floor can also be helpful. You might have heard of Kegel exercises in the context of women's health, but they're beneficial for men too. Strengthening those pelvic floor muscles can help with urinary control and sexual function. The basic technique is to contract the muscles you'd use to stop your urine stream, hold for a few seconds, then release. Do a few sets of these throughout the day. Fifth, manage your stress. Chronic stress increases inflammation throughout your body, and the prostate is no exception. Find ways to decompress, whether that's spending time in nature, meditation, time with mates, or whatever works for you. Here in Australia, we're lucky to have some of the most beautiful natural environments in the world. Get out there and enjoy them. Sixth, maintain a healthy weight. Obesity is associated with increased prostate cancer risk and worse outcomes for men who do develop the disease. If you're carrying extra kilos, particularly around your middle, that's something worth addressing for your prostate health and your overall health. Now, let me talk about something that not enough men pay attention to, and that's the signals your body sends you. Your body is constantly communicating with you, and part of being proactive about your health is learning to listen. During masturbation or sexual activity, pay attention to any changes. Has the sensation changed? Is there any discomfort or pain? Has your ejaculate changed in color, consistency, or volume? Is there any blood? These observations might seem awkward to think about, but they can provide early warning signs of problems. Any blood in your semen should prompt a visit to your doctor. Same with persistent pain during or after ejaculation, changes in urinary function, increased frequency, difficulty starting or stopping, weak stream. These all warrant investigation. I'm not saying you should become paranoid about every little thing. Bodies change as we age, and not every variation is cause for concern. But awareness is important. You know your body better than anyone, and if something doesn't feel right, get it checked. Let me circle back to something I touched on earlier, the emotional side of all this. For many men, their sense of masculinity and self-worth is tied up with their sexual function. When things start to change in that department, it can be genuinely distressing. I want to reassure you, blokes, that changes in sexual function as you age are normal and don't define your worth as a man. Erections might take longer to achieve and might not be as firm as they were at 20. Recovery time between ejaculations increases. Orgasms might feel different. These are all normal parts of aging. The key is to adapt and maintain your sexual health in whatever form works for you. If you're in a relationship, communicate with your partner. If erections are an issue, talk to your doctor because there are effective treatments available. And remember that sexual pleasure and satisfaction don't require the same performance metrics you might have had in your younger years. Masturbation, by the way, can be a valuable way to maintain your sexual function even if partner sex isn't available or possible. It keeps the neural pathways active, maintains blood flow to the area, and keeps those pelvic muscles in working order. Think of it as maintenance for your sexual system. I've been talking for a while now, so let me summarize the key points I want you to take away from this. Your prostate health matters. This small gland has an outsized impact on your quality of life, and looking after it should be a priority, especially as you get older. Regular ejaculation is beneficial for your prostate. It helps prevent congestion, may reduce your risk of prostate cancer, and supports overall pelvic health. Aim for regular activity rather than extended periods of abstinence. Get your checkups. PSA testing and regular conversations with your GP about prostate health could save your life. Early detection makes all the difference. Support your prostate with a healthy lifestyle. Good diet, regular exercise, stress management, and healthy weight all contribute to prostate health and overall well-being. Listen to your body. Pay attention to changes and don't ignore warning signs. You know your body best. Maintain your sexual health as part of your overall vitality. Your sex life, in whatever form it takes, is part of what makes you feel alive and connected. Don't give up on it. All right, folks, that's what I've got for you today. I hope this has been useful and has given you some practical information you can act on. Looking after your prostate isn't complicated, but it does require attention and intention. If you've got questions about anything I've covered, drop them in the comments below. I read all of them and do my best to respond. And if you found this helpful, share it with a mate who might benefit. Men's health isn't something we talk about enough, and the more we can normalize these conversations, the better off we'll all be. Take care of yourselves, gents. Your health is your wealth, and you're worth looking after. I'm Dr. Liam Cartwright, and I'll see you in the next one. Cheers.